Hi, good day. Thank you for joining us in another edition of our Health Talk series. Today, in continuation of our Women's Health series, we're going to be talking about diabetes in pregnancy. Diabetes means high blood sugar in the blood and the body. If it happens in pregnancy, it is called gestational diabetes mellitus. So it has to be in the pregnancy only, meaning there wasn't any history of diabetes or high blood sugar prior to being pregnant. That is what makes it gestational diabetes mellitus. But what causes diabetes in pregnancy? It is not usually known what causes this condition in pregnancy. But there are risk factors that predispose women to this condition. The risk factors that cause some women to have high blood sugar in pregnancy include high maternal age from 35 years and above. If you are 35 years and above and pregnant, you are going to be highly likely to have diabetes mellitus or gestational diabetes mellitus. Then there is another condition called polycystic ovarian disease, meaning multiple cysts in the ovaries, multiple water-filled cysts in the ovaries. If a woman has this condition, she is also likely to have gestational diabetes mellitus. And if there is a family history of gestational diabetes or diabetes mellitus in any sibling or any parent, the woman may also have gestational diabetes mellitus. Just being black, the race black, predispose women to have gestational diabetes mellitus. And being overweight or being on the high side, as some people may call it, also predispose some women to have gestational diabetes mellitus. So how do we diagnose gestational diabetes? Diagnosis of gestational diabetes is usually clinical because there are usually no symptoms. Clinical meaning it has to be tested in the lab. Routinely, all pregnant women have their urine and blood samples taken to test for blood sugar, whether they have diabetes or not, whether they have symptoms or not. So it is in this antenatal care that usually women with high blood sugar in pregnancy are found. And this test is called screening test. So if you are being screened and it is found that your urine or your blood has high sugar level, the doctors or the midwives will now come and test you. The definitive diagnostic test is called oral glucose tolerance test, OGTT. It is a test that is done in the morning before the woman has her breakfast. She comes to the hospital, a blood sample is taken, and she is given a sugary drink, and after each hour for up to about 3 or 4 hours, her blood sugar is measured to make sure to check if there is high blood sugar. If there is high blood sugar, gestational diabetes is diagnosed. So how is it managed? Gestational diabetes is managed by lifestyle modification first. Lifestyle modification meaning you have to change your diet and you have to adopt exercises. Exercises meaning physical activity. Yeah. So as you do these lifestyle changes, physical activity, increased physical activity, and lifestyle modification of your diet, the sugar in your blood and your urine is serially monitored to see whether the sugar level is going down. The dietary modification include low sugar diet, or what we call low glucose index foods or glycemic index foods that are low, as opposed to high glycemic index foods. Low glycemic index foods include beans, vegetables, lentils, cassava, for example, acha, while high glycemic index foods like rice, pasta, and all other, fast digesting carbohydrates are avoided. Right. So if this lifestyle modification fits you, the sugar will go down and the diabetes in the pregnancy will go. But if the sugar level is not going down, the doctors have no choice but to institute a treatment option with insulin injection. Insulin is instituted because oral medication usually is not compatible with the baby. So together with the insulin therapy, you continue the dietary and lifestyle modifications together with the insulin therapy. This way, it's usually found that the blood sugar will go down and is going to be addressed and treated until the end of your pregnancy. What are the complications of gestational diabetes mellitus? You are highly likely to have diabetes after pregnancy if you have had gestational diabetes mellitus. And during the course of your pregnancy, gestational diabetes mothers usually have what is called macrosomic babies, babies that tend to be very big because of the blood sugar, and they are usually prone to elective cesarean section. These are some of the complications. Thank you for listening, and see you next time.